Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech product manager Parker Anderson, and as always, I am joined by RipsyTech founder and CEO Tom Tarshis. Hi, Tom.
Hi, Parker. Nice to see you today.
Good to see you too. So let's jump into today's topic. Today, we wanted to talk about developing a specialization as a mental health provider. I'm not a mental health provider, but I think most of what I come across is somebody who does not have a specialization, somebody who is, they went to school, they got their degree, they got their license. And then specializations beyond that, I have some ideas of what those types of specializations might be, but I'd be interested to hear from you, what types of specializations exist and how do these differ in terms of, where the provider is focusing or what type of care they're providing.
Yeah, and it's a fun topic to discuss, and there are lots of different ways that mental health providers quote can specialize, and there are actual certificate programs, fellowships, extra years that a lot of different disciplines can do. But in thinking about it, you could specialize based on diagnosis. So you become an expert in treating a certain diagnosis. Good examples of these are obsessive compulsive disorder or post-traumatic stress disorder. There's not too many people, I would say, who specialize in depression or anxiety, just as general terms. But some of the more niche, I don't know if niche is the right term, but some of the more specific subcategories of different diagnoses, you can see that specialization. There are people who specialize in certain patient categories. So this might be LGBTQ plus populations. It might be women's issues, men's issues, postpartum. So any sort of distinct patient group, you can decide to specialize in that group. And then there are treatment type, there are age specializations, which sort of fits with that other piece that are you going to work with a specific age group or not. And then there are specific types of treatment that you can get certified in. And this could be, you're going to be certified in a certain therapy like mentalization-based therapy, or you're going to do extra training in cognitive behavioral therapy, or you're going to become a psychoanalyst and do analytic training. And so those are also specializations in the type of treatment you provide, although that treatment can still treat a range of diagnoses and patient ages. So there is this wide realm of specialization that's available in mental health care. I'd say that, if you go on like Psychology Today or look at most mental health clinicians, you don't see people doing very specific specialized treatment. So I don't think it's necessarily the norm, but it is something that is definitely out there.
So if I'm a mental health provider, and I imagine there's kind of different routes to this depending on whether you're a physician, like a psychiatrist versus a therapist, that, if I'm a mental health provider and I decide I want to specialize in something, like where do I go to do that? What's the path that one's supposed to take to be considered, specialized?
That is a great question, because on some levels, anyone could say that they're specialized in anything as long as you're licensed. You can say, here's what I work with, or my specialty area is. And we know this from just patient care, that patients don't really come and say, let me see proof that you're specialized in X, Y, or Z.
Right.
So in in very, so for example, in child psychiatry, you can do a forensic fellowship that lasts a year, and you get extra training in forensic work, which might be in courtroom settings or working with incarcerated populations. But you don't need to do that fellowship in order to work with these populations or say that you're an expert in those areas. For a lot of the therapy certifications, you complete programs and get certificates and can get certifications through that route. Yeah, and I'm thinking, there are programs to go through for different prescribing training, different therapy training, different for doing trauma training that you can go through and get a certificate. All that being said, like, how am I going to phrase this? The cynical part of me is that a lot of these trainings have really evolved into money-making ventures for the people who run the trainings. I don't
I
know if
see.
that is totally fair to say. And there's been lots of good trainings that I've been a part of or attended where it's been done very well. But for something like, an example of this is the ADOS, the Autism Diagnostic Test training that any mental health professional can do, because that has become a gold standard for diagnosing autism. Getting that aid, and because of some legal requirements around people needing a ADOS certified exam, that has become a real an interesting training or certification to think about some of these issues around, is this really serving the patients that we see, or is it something else?
Okay, gotcha. And then for you as a child and adolescent psychiatrist, would you consider being a child and adolescent psychiatrist a specialty, like how you had to go through was it a fellowship to earn that designation?
Yeah. Oh, yeah. Great, very relevant question. So, doing my child fellowship. So if you're just going to be a psychiatrist after medical school, you do a 4-year residency, and you come out as a general psychiatrist, which sort of means you can do anything. And a lot of general psychiatrists will start treating kids age 13 and up. I'd say child psychiatrists, you get that extra training with all ages, but especially younger kids, maybe a little extra family work. The biggest issue where the child fellowship will help you, and it's painful to say this a little bit, is if you're decided to treat a 10-year-old as a general psychiatrist and something bad happened, you wouldn't do well in a lawsuit without having done a child psychiatry fellowship.
I
They would
see.
attack you for not having that training to work with a 10-year-old, and whatever happened that caused the people to sue you, that could be an issue. Yeah, but it's, that doesn't mean there aren't people who've only done a general psychiatry that aren't outstanding at working with kids and families. So it is, and I've had many friends who, there are a lot of reasons you may not want to do an extra year or two of training to get your life started when you've already been in school for a very long time. And yeah, so I think, a big piece of it is, when you're doing some of that initial training, you get exposed to lots of different patients, hopefully lots of different therapy treatments. And if you find that you really love something, that you are super passionate about it, and this is maybe coming up to some of the other questions we're going to discuss, like as a provider, I think that's when you can think about specializing or saying you specialize in that field if you really love that type of work. And that's what is most likely going to make that a good fit and make you excel at that, whatever you quote decided your specialty is going to be.
Gotcha. Okay. Yeah, that I'm tempting skipping ahead to that question, but I think before we do, it would be smart for us to talk about I mean, in general, are there any pros and cons to specializing as a mental health provider?
Yeah, and so as we've talked about lots of times, we have the supply and demand issue where demand far outpaces supply in for mental health treatment. So from a business perspective, though, if you really develop a skill at treating a certain diagnosis or age group that otherwise may have a hard time finding care. So, for example, if you become an expert in the March CBT protocol for obsessive compulsive disorder treatment, there are not a lot of people who are experts in doing that therapy, but there are a lot of kids and adults who have obsessive compulsive disorder. So it might be a way to funnel that specific more interest to your business and to connect you with, and if you are good at that, word of mouth will spread and it will help you fill up your practice, and hopefully you enjoy doing that. So for whatever the your specialty is, there will be people with that specific diagnosis, or rarely there will be patients who know they want a specific type of therapy. So there's EMDR treatment for trauma, eye movement desensitization treatment,
Hmm.
where you go through some specialized training to learn how to do that. There are patients who will be looking for a practitioner who can do the EMDR, and that's going to drive, if you have that skill, it could drive more patients to your practice. Um, I think the drawbacks are if you're the OCD or EMDR specialist, maybe someone who sees that and wants treatment for depression or anxiety or family issues or another diagnosis, is not going to reach out to you. Um,
Oh, I see. Like if somebody sees that you specialize in this one thing, they might think like, well, they're not going to be able to treat me for this other thing, even though that might not necessarily be the case.
right, right.
That makes sense. All right. Well, then talking about what we were talking about earlier, what factors should somebody be considering when they decide they want to specialize in something? How do they determine what the best thing to specialize in is for them based on their, interests, skills? Um, and I imagine demand for that specialty might also be a factor.
Yeah, and there, I think the other thing to consider there is also what kind of job do you like? Like,
Mm,
for example, if you're really passionate about treating people with serious mental illness, like schizophrenia, psychotic illnesses, but you really want to only have an outpatient practice where you take cash, like that is not going to mix together because most of those patients are on insurance of one type, usually on Medicaid type or Medicare insurance. And in addition, those are diagnoses that you really need a team. And a lot of people who are very passionate about that work will tend to work for a hospital setting or a more intensive treatment program. So that's a big piece. Another example is if you're passionate about eating disorders, that is another multidisciplinary team best approach. You can do a outpatient solo practice as a therapist or psychologist or psychiatrist treating eating disorders, but it's going to require a lot of extra care coordination with the nutritionist team. There are times you need to have direct lines to hospitals, and it's going to make it a lot more complicated. So, a big factor in deciding for the specialization is also what do you want your job to look like when you finish your training. I think once you've handled those considerations, it should really go down to what are you passionate and skilled about. um, what are the is there some extra training or that you would like to do to call yourself a specialist in this area? Have you just done enough in your general training and you're passionate enough about it and can do continuing education on your own that's good enough to go into that specialty, which is valid? That's where the thought process and decision making should be.
Yeah, I mean, that makes a lot of sense. I mean, it's in general, I think it's good advice to pursue things that you feel is like bring you satisfaction, that you feel talented at. Yeah, no, good stuff. So I don't know if this is something that you can answer specifically because it deals a little bit with, the history of the mental health profession. Do you have any insight into how, specializing in something as a mental health provider has evolved over time? Um, and maybe what areas have kind of evolved into becoming more high demand specialties?
Yeah, it's actually a really great question because if you go back 50 years, maybe even less, there really wasn't anything as specialization. Like going into mental health treatment was sort of the specialization that you're going to be a work with mentally ill patients. You can see the proliferation of specialties just if you look at the number of board exams in that doctors can take now for geriatric, forensic, addiction psychology, child. Like none of these existed. None of them have been around for very long in realms of treatment. In addition, these courses to get certified in different therapeutic modalities, they didn't exist 50 years ago, right? So with the evolution of specific types of therapy treatments and other training paths that just didn't exist many years ago, that's been this rise of specialization for mental health providers. Um, I think, with respect to like what are current areas of high demand, I have to just say like providers who will treat kids.
Mm,
Um, and kids and people who will do family work and couples work tends to be areas with exceedingly high demand, and the population of mental health providers who will do child work or family work or marriage work is not that high. So if you have any interest in those areas and want to, do an extra training on family work, or if you're not a physician, to do extra work with kids during your training as a therapist or psychologist, that can really open doors for you, and is much needed.
I believe in most of our guest episodes where we talk to providers who treat children, that was a resounding common theme, which is needing more providers who specialize in seeing children, especially child and adolescent psychiatry. Yeah.
Very true.
So just to round things out here, do you have any examples of how developing a specialization maybe has transformed somebody's career, of anybody that you know, or um, have you seen, somebody specialize in something and have that transform their approach to patient care? Anything like that?
Yeah, I mean, we've definitely have worked with and employed a lot of, I've mentioned earlier, people interested in serious mental illness. So occasionally you get the very passionate individuals who are like the challenges that come along with, specifically teenagers with severe suicidal ideation and self-harm behavior, and working with those teens and those families. And that has pushed them into career paths in more intensive settings like intensive outpatient, partial hospital, and inpatient. I've known social workers who've worked with in a hospital setting, kind of doing the social work piece for patients, but then were so passionate about providing the care, decided to go to medical school to become psychiatrists so they could do even more for their patients. And I think it's nice. This is a helping field, and I think in general, people who go into the field are passionate. And then when that passion, if that passion evolves around a specific, again, treatment or diagnosis or age group or population, that's exciting and nice to see. And I know a lot of psychiatrists and practitioners of color who are dedicated to working with underserved populations and in the communities that they came from. There's programs at like UC San Francisco to help encourage not just people going into mental health practice, but all fields to who come from those underserved backgrounds, to give them the extra support and guidance so that they can go back and serve their communities. So it is one of these, how do we make the field better? And a lot of people have talked about, finding that passion in people who are going into the field and helping to narrow it specifically to keep people involved. And I think this theme fits with that. And yeah, it's nice to see when people are really passionate about any specific piece of mental health treatment.
Absolutely. All right, before we move on, is there anything else that you would like to mention about specializations, Tom?
Yeah, there is some data on this, the data in general around, probably the most common request that comes in is our kid would like, this type of provider, female, male, trans. And in general, the research shows that that's actually not that important for the outcome of just, general mental health care for the patient. That it's less about what you think the practitioner's demographics should look like, and it's more about the connection that they make with the patient. A lot of this work has been done on the gender, like, is there a difference between male and female providers when patients request it in outcomes? And the answer is definitely no. It's that same thing where, is there a difference between therapists, social workers, psychologists, or psychiatrists and their skill at therapy? And the answer is really no, there isn't. So it's just something that goes along with, just because you're not specialized in something doesn't mean that you might not be good at it. So please don't turn patients away who are maybe trying to see you because you're worried about not having the skill set to take care of them.
I'd say that makes sense. Okay, great. Let's move on. Let's talk about the mental health business moment of the week.
Yeah, and I always the most, I'll pull out the frustrating mental health business moment of the week, which is I guess I won't name the name of the service, but we use a payroll service, and because of experiences in the past when I was naive, I've really liked to take advantage of paying a little bit extra to make sure tax filings happen on time and there's no penalties. And so 2 days ago, I opened the mail and there was a letter from the state of California saying, here's your penalty for not paying something. So in the midst of figuring out why, when I've been paying for this service to make sure we're doing our taxes and payments properly, I just got this unpleasant thousands of dollar bill with a penalty. Hopefully it's just these clerical or technology glitches happen, and hopefully it will be resolved soon. But no one likes opening their mail and seeing
No,
you owe X thousands of dollars with a big penalty on it. Kind of ruins your day.
yeah, I could get something with $40 and it would ruin my day.
Yeah.
Well,
fair enough.
Well, yeah. Okay. Well, yeah, it sounds like a very rough mental health business moment this week. Well, okay, Tom, I think now would be a great time for us to wrap things up. Anything else you want to say?
No, yeah, fun topic to discuss. So we'd love to hear from people who've specialized a little bit. I think a couple, at least one of our podcast guests who does the walking therapy
Mm-hmm.
is an example of someone who's taken something they're passionate about and turned it into a specialty. But
Yeah, another one of our guests talked about trauma-related work as well. So, Yeah, it's always really interesting, I think, to talk to providers who have, found not niche necessarily, but just the type of help that they feel like they're best equipped to provide, and then providing it and finding great career satisfaction from that.
Agreed.
All right. Well, thank you for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. Please submit your questions for an audience Q&A to our email at sitandstay@ripsytech.com. You may also email us there if you're interested in featuring as a guest on the show. Tom, it's been great. I will see you later.
Thanks, Parker. Have a good one.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.